in demography for fertility, which include looking at fertility itself, looking at infertility, but also looking at the terms of fecundity and infecundity. And we have continuously used these words, and it is very critical. I keep on repeating that you understand the words and you know their key meanings. And we also looked at the measures, the key measures of fertility in the population. We looked at the crude birth rate. We looked at the fertility, total fertility rate. We looked at the net production, and we were able to understand the meanings of these, but also we looked at the replacement method, how a particular population can have the number of live birth to replace it. But also we looked at the age-specific fertility rates and how we can calculate them. If you were not able to have a glimpse of that lecture, I would request that you follow up from there, and so that you will be able to have a clear idea of what we're discussing in this particular module. And then we were able to look at the different causes of fertility and infertility. And we said there are social and economic factors. We said there are cultural factors. Among others, we discussed as many as we could. But lastly, we were able to discuss what we call the Bogart's theory, and how he believes that it is not actually the socioeconomic, environmental, or cultural factors that cause disease, that cause fertility, but instead they are what he calls intermediate factors. And these intermediate factors are the ones he refers to as the very close factors that are actually responsible for fertility, to determine fertility in a societal level. And he looks at 9 very critical proximate factors that we looked at. And we looked at marriages, we looked at contraception, we looked at lactational amenorrhea, postpartum abstinence, we looked at pathological sterility, we looked at induced abortions, we looked at the frequency of sexual intercourse, spontaneous intrauterine mortality, and natural sterility. And we were able to discuss all these and how they respectively affect fertility. So, like we said, lactational amenorrhea, through lactational amenorrhea, okay, let me just share with you the screen of what I'm talking about. I hope you can see the screen, eh? Those are the particular factors or determinants we looked at. And we said that whereas factors such as income, such as someone's educational level, someone's place of residence, or other demographic or socioeconomic factors or environmental factors may well affect someone's level of contraceptive uptake, they don't directly affect someone's fertility levels. So these socioeconomic factors first affect someone's marriage or someone's contraception. These key proximate determinants that Bogart is talking about, and therefore when they are able to affect, for example, someone's level of education may affect their uptake of a particular contraceptive, or someone's place of residence may affect their access to a particular contraceptive service, which means therefore they will not use contraception. That means that the possibility therefore that they can be able to produce or have conceive and be able to conceive is very high. Likewise, someone who may be educated may have knowledge on contraceptive, and therefore may realize that because of the different side effects, they cannot be able to uptake it. So someone's environment, again, may be able to influence someone's sterility. Whether this person, like natural sterility, where we say that the only fertile days of a woman are 2, and therefore an environmental factor might be able to influence someone's ability to be fertile in those 2 periods, but also may be able to influence whether someone can conceive at that period. So today we want to look at what we call the emotional challenges, or we are looking at the psychological and social implication of infertility. So we realize that most of our societies face, because when you're able to look at the statistics that we shared the other time about infertility, let me just, yes, around here, you see, around here, you see 10 to 15%, 10 to 15% of couples globally are affected by infertility. Then they are also saying that 180 million couples are facing infertility, and infertility care is being neglected. So when you're able to see this prevalence, for example, at 9.3 maximum in the less developed countries, that means that we have a public issue regarding mental health. But also away from mental health, that means we have an issue psychologically, and this might be a social issue. Whereas mental issues might be individually based, when it comes to psychological, you realize that there is always a third party of the society that is causing a lot of stigma to these individuals. So let me just share with you now that slide for psychological and social implications of infertility. So there, we want to first look at the emotional challenges faced by individuals and couples. So the emotional roller coaster includes sadness, we look at frustrations, we look at anxiety, and we look at hopelessness. But also we look at stress on the relationship, strain on communication, intimacy, and shared goals. So we realize that in communities or in families where there is an infertility, there is always sadness, there is always frustration, anxiety, and hopelessness. But again, at a couple level, people strain. It strains their communication, but also it strains the intimacy in terms of the sexual intercourse and then the shared goals of the couple. Then we also look at coping mechanisms. Individuals may employ different strategies to manage their, just excuse me a little there. Sorry for that interruption. So when you're looking at coping mechanisms, you're looking at individuals may employ different strategies to manage their emotions. But we realize that away from the coping mechanisms, we have realized, especially the party that is infertile, is the one that is going to use defensive mechanisms. For example, if it is the man, there are chances that the man will go out and get another woman. the coping mechanism may not be, the strategy may not be a positive one on a relationship, because then one party may feel aggrieved that they cannot bear children of their own, and therefore you will realize that one, they may take a step to move away from this kind of union. Two, they may decide to adopt. Three, they may also decide to cause a lot of gender-based violence. This is actually one of the causes of gender-based violence in many of our societies. But it has not yet come to the limelight as a public problem, as a public health problem. But you realize that most times the party that is suffering may have no say, but the one who is not, who is fertile, or who believes that he is fertile, may decide to go away and try to prove that for them they can bear children. So, but also sometimes because they may decide to copy positively by going to the church, getting wedded, and believing that this is just a godly thing, and therefore they will overcome one time. So that godliness, or being able to go to the church, you're able to receive counseling, and then you're able to manage. So now, support and counseling for infertility patients, it means that when this kind of counseling may come from the church, but also it can be professional counseling around health facilities, or if they are what we call community-based counseling, or the support groups. These are some of the support you can offer to individuals who are infertile. So counseling promotes their emotional and psychological being. Professional counseling, mental health professionals provide coping strategies, but also support groups connecting with others who understand the experience. So in professional counseling, you will be able to offer these people coping strategies, and therefore it requires you, one, as a public health expert, but also as a demographer, or as a nutritionist or dietist. You should be having counseling skills. You should be able to know what to do. For those who are studying counseling, you should be able to have those counseling skills, because these are the people you're going to face who will be having a lot of troubles and so forth. So you should be able to provide for them coping strategies, and you should be able to bring for them what they will refer to as role models, who they can connect with, possibly people who have experienced such, but they have maneuvered through and they have stronger mental feelings. So therefore, they will act to them as what we call as role models in that case. So to address emotional needs, it means there needs to be an open communication. You have to encourage the honest conversation among the couples, because then if the couples come to you because now they are in an emotional need, possibly because as you've diagnosed them with a sense of infertility, either one of them, then there needs to be an open communication. And this open communication involves telling them being able to stress to you the kind of intercourse they have, a lot of things. For communities that are developed, you realize that people who are even homosexualities would come in for counseling. Why? Because they are regularly having anal sex, but for them they may be thinking that there is possibility of being fertile or of conceiving through there. So if such a case is there, the person needs to have an honest opinion, but also a honest conversation with you, in order for you to understand how deep their problem is, and then offer for them a particular solution in that regard. but also we're looking at self-care. So, emotionally, people will be strained out. So you need to be able to explain and promote practices that reduce stress and promote well-being. And this can be issues of you should be giving them an advice, or you should be employing them to be able to have time for themselves. Because when you're emotionally strained out, then you should be the solution is inborn. How you should be engaging in activities that are less stressing. So less stressing means that either you're engaging in outings, you're a little busy, or as a couple you're able to move away and just forget about the fact that you're very infertile. So all these are counseling skills that you should be able to offer to that couple that has an emotional need. But also the couple themselves have to seek professional help, and timely intervention can prevent emotional distress. So there are some people who will continuously wait, and because most times it is men, because men, the societal thinking is that a man should be strong, and that like the same way we face problems in men seeking health care is also the same way we is also the same problem we face for men to access emotional need, because the society perceives them to be stronger than women. And therefore, for a man to to seek professional help as early as possible is taken as a societal norm. However, it is very key to seek professional needs if you're to address the issue of emotional needs. So what are the roles of you healthcare professionals? You need to have provide an emotional support. So if an individual is able to come to you after seeking professional help, you should be able to provide emotional support, compassion, and empathy in medical interactions. So empathy does not mean sympathy. So with sympathy, when you see your client is crying, you also start to cry. Then there, you're acting very unprofessional. So empathy means you're offering hope that their problems are solvable. So as a medical, when you're doing your medical interaction, you should be able to understand what is the state in which this person has come. What can I offer as a solution to them? You should be able to offer that perfectly. Having gone through a counseling class, you should be able to understand that when you're offering an emotional support to someone, they should come a little bit satisfied. But this means that you have to follow the principles of counseling that include confidentiality, privacy, and all that. So it means that you should be able to give this person an environment where they can be able to open up to you. But also, you should do referring to specialists, recommending mental health professionals when needed. Sometimes these issues become very mental, that someone becomes mentally disorganized or mentally ill. So it is upon you as a healthcare professional, or as a reproductive health specialist, as a public health specialist, as a demographer, you should be able to ascertain this person's level of mental weakness, and then you're able to refer to a particular health professional. Then we look at holistic care, addressing emotional and psychological aspects along with medical concerns. So whereas you're looking at the person as a psychological victim, you should also be able to address their medical concerns. Sometimes they may be able to ask you whether there is no solution for this kind of infertility, like taking drugs and so forth. So you should be able to handle these things as a dual care, meaning as a holistic meaning you're handling all their concerns at once. You don't only handle one issue and then leave the other. Your client will feel that they have not been helped at all. So in this case, you should be able to come up and address the issues as a whole. What the client faces, whether emotional, whether psychological or medical, you should be able to handle them holistically. So dealing with stigma and social pressure, like we stated earlier in infertility as a cause, we know that stigma and societal pressure is a very huge challenge in among people who are infertile. So how do we deal with this? One, we need to raise awareness. Two, we need to support networks. Three, we need to promote inclusivity. So you need to educate society about emotional toll of infertility. Just the same way we approach the stigma against HIV and AIDS, the same way we approached stigma against individuals who had COVID-19, is the same way we should be able to raise awareness on infertility. That there are, one, we have to raise awareness on the preventive measures. Two, we have to raise awareness on the therapeutics. But also now we need to be able to raise awareness on those that are chronic, meaning for lifetime. Because if we're doing preventive awareness, that means those who have not reached a secondary stage will be solved. How? Because you're preaching the message on the feeding type, on the lifestyle. So the way people will be able to feed, the way they will be able to have their lifestyle can reduce the chances that they will be infertile. But also therapeutics, for those who are already infertile, you should be able to offer them solutions on how they can change certain diet, on how they can be able to seek certain type of care or certain type of treatment for those that are still in their initial stages. And this can be reversed. Then thirdly, you should be able to offer the education to the society about how, for those who are now permanently infertile or for those who are chronic now, you should be able to offer to the society information that stigmatizing these individuals has an emotional toll on them. And therefore, if you continuously stigmatize them, there are chances that you will lead them to their early grave. So you should be able to educate the society and raise awareness on those three key infertility messages. And then you can be able to solve the issues of stigma. But support networks also, you need to create safe spaces for individuals to share their experiences. So you will be able to bring individuals that have suffered the same cases, and you can be able to bring them along so that they are able to share experience, possibly how they have overcome, like that, so that they feel at peace that they are not the only people who have suffered such injustice. Then we talk about promoting inclusivity. Now here we're looking at emphasizing that families take many forms beyond biological children. So you're able to ask and tell them that it is possible to have children around or to have a family around, but not necessarily your own biological children. So you should be able to emphasize to them that families are different, in different forms or types, and therefore, if they do not have, it is fair that they can also include other children. That is why today you're able to see that there are people who are adopting children who may not be their own, but they are they are adopting them and they are doing very well. So we want to look at the counseling approaches. How do we then offer this kind of counseling to the people who are suffering or who are victims of uh, of infertility? We look at individual counseling, we look at couples counseling, and then we look at group counseling. So individual counseling is tailoring strategies to personal emotional needs. So you'll be able to share with this individual, and the person, it's a one-man face-on talk, and then the person is able to explain to you what actually they are facing or what their problem is, what we're calling an emotional need. So if this person is able to explain to you what their personal need is, then you deal with the personal need accordingly. You'll be able to understand the strategy directly. You'll be able to handle that person's situation accordingly. Possibly the person is telling you that they cannot be able to erect. So you should be able to give them strategies individually on how they can overcome this particular problem. Then coupling counseling is most times about strengthening communication and understanding that this person is now in this situation, but it's because of your intimacy or your emotional being that you felt you should be together, and it is very key that you should indeed remain together. So you should be able to offer that advice where people can strengthen their communication. The couple should be able to talk more frequently and more intimately, but also they should be able to talk in an understanding mode. Then the other approach is the group counseling, where we are looking at the sense of the community, but also we are looking at shared experiences. So the group counseling can be problem specific, where you're looking at only mothers or fathers or people who have experienced these problems, or you can also have a group counseling of the community itself, so that you're able to offer them support and strengthen the fact that the community is able to understand that these problems actually exist, and therefore lessen the stigma that is in there. Then we look at coping mechanisms for individuals. So after suffering such psychological problems, you should be able to cope up with the problem. So we want to look at what are some of the coping mechanisms. How can someone cope up with the problem that they are facing? And one, we're looking at the mindfulness and meditation techniques for managing stress and anxiety. So an individual should be able to meditate and be able to be mindful of the problems that they think about. This can help in managing stress. The person is able to sit down, meditate, that this is just by the way, something like that, so that they can be able to manage the stress and the anxiety that is in there. And then they should be able to be mindful of what they think. But also we look at creative expression, art, writing, hobbies as therapeutic outlets. So if this person is a sports person, they should be able to go out, spend time doing some art, writing some books, storybooks about possibly their experience, but also engage in the different hobbies that they have. And this can help them as a therapeutic to manage. But also seeking joy, that's what we're looking at. Engaging in activities that bring happiness. For the youthful population today, we look at them going out, spending a lot of time out like that. However, don't encourage such people to take a lot of drugs and substance abuse. Most times that is what they do. However, as a counselor, you should be able to offer for them support that is more that is more healthy than also taking them back to what is already going to be a health challenge for them, because then they will be able to suffer. Because if you offer them alcohol as a solution, then it may not be easy there. So navigating relationships, open dialogue. So here we are looking at how an individual can cope with the problem. Here we are looking at how the couples can cope up with the problem. So they need to have an open dialogue. They need to discuss the emotional challenges within the partnership. They need to support each other. As a couple, you can provide comfort and understanding to your friend, but also you need to seek professional help in there. And this includes what we discussed earlier in there. So we also now want to look at the prevention of infertility. And we're saying there are cost-effective treatment strategies. We're saying especially in regions with high infection prevalence. Prevention has numerous advantages: cost-effectiveness, broader impact, improved women's health. So, like I said earlier on, you should be able, we're looking at 3 stages. One, that this should be prevented. 2 is that your information tailored should be about therapeutics, how this can be treated. 3 is now that you should be able to go to the societal level and educate the society that now this problem is like this, and therefore you should be able to believe that because the problem is this way, then all you can do is stop the stigma. So those are the 3 main issues. So in prevention, we are looking at because we looked at the causes of we look at the causes earlier on of infertility. Now, doing away with those causes, one, we looked at the environmental factors, and we were talking about exposure to certain radiations. For example, exposure to X-rays. These are ultra rays that may cause your cells to be damaged, and therefore, if you're exposed to such rays, possibly at a late reproductive age, for say for women at the ages of 40 to 45 to 49, when they are about to clock their menopause, the chances are that they may be able to be, the cells are exposed to these ultra rays, and they may be able to damage their cells. And those are some of the causes we said. But also we said that people who are exposed to certain environmental conditions, maybe at birth, they may also be able to be infertile. So in order to prevent infertility, you need to go back to the causes and then be able to go to the affirmative side of the causes and say, if it is caused by the X-rays themselves, which are environmental factors, then individuals should be able to be less exposed to such. We also talked about diet itself, the feeding culture of an individual. Then the individual should be able to have a balanced kind of diet. But also, as a cause of infertility, we looked at how issues of inactiveness, physical inactiveness, that someone becomes excessively obese are some of the causes. Therefore, people need to be physically active. So we cannot repeat here how to prevent infertility when we discussed its causes earlier on. So you should be able to look at the causes effectively and be able to understand how people can actually prevent this. For us now, we just want to look at what are the advantages in here. The advantages of prevention is that it is cost effective, but also it has a broader impact because the women will have an improved health. So there are very many causes in there infertility. We also know that sexual inactiveness can cause infertility. We have seen cases of fibroids coming up. Why? A certain doctor said that an empty uterus is a workshop of fibroids, because the body in its nature expects that there is supposed to be a conception that takes place. However, when it does not take place, something else grows in that particular position where a baby is supposed to grow. So those are the problems that may be faced in there. So that is why in many studies today, if you looked at studies relating to fibroids, you realize that women who are highly educated or women who have higher levels of education have higher chances of developing such complications, possibly because they spend more time chasing their career than taking on the role of becoming either a mother or conceiving. And therefore, at the end, the chances that they may develop such problems is in there. But also you see it there with the religious nuns. Most of them could also be facing the same problems, because the natural creation is in that they should be able to conceive at a certain age, from the ages of 15 to about 49. So if that does not occur, the chances that people face some of these challenges is in there. So we want to look at also the integrated care approach. Prevention programs can be integrated into mother care and family planning services. So when you're going in to preach the message of prevention, you should be able to integrate this in different services that you're offering. If you're offering mother care services, if you're offering antenatal care services, or family planning services, you should be able to integrate the idea of prevention into those services. So you should be able to inform those people on how they can actually prevent infertility. But also, you should be able to address to them the importances of prevention, because it addresses the social consequences, and the health status is generally improved. The social consequences it can address are the issues of stigma. So you should be able to give them an integration into the different services you provide. So whether you're giving a nutritional service, whether you're giving an antenatal service, whether you're giving a HIV testing service, or whether you're going in for a community dialogue, you should be able to integrate the prevention message in the particular activity you're taking. So we are looking at balancing prevention and treatment. And we want to say that a government should prioritize education and prevention. That is the key message I said earlier on. Because if you prioritize education and prevention, for those who have studied health education and health communication, you'll be able to understand the aspects of education. So this is a very critical issue in trying to prevent. So if you prioritize prevention, it means that there is going to be a low cost. When we are talking about cost effectiveness, the cost of treatment of treating these infertility issues are very high, whereas they could actually be treated easily. So because because of challenges that you may not be able to prioritize education or prevention, it means more people will be having prevalences of infertility. and at the end, the government spends lots of money in buying drugs, in buying equipment, in hiring personnel to try and handle issues of infertility, whereas you could actually reduce those costs. So issues of ethical consideration of denying infertility treatment when prevention fails should be addressed as well. So most times we know that sometimes we have challenges with our healthcare professionals regarding ethical considerations. And sometimes someone, when they come with such conditions, they will be addressed to stigma at the health facility by saying, hey, we were telling you this and that, and you did not follow. So this should be taken account of by the government. So more about the ethical consideration is that the human rights and reproductive rights calls for accessible infertility treatment. But also there is a need to address social reactions, psychological and economic consequences that we talked about. Economic consequences meaning that for someone to access care on infertility, you need to consider having a subsidized price, because then these are very expensive ventures. But also you should be able to offer these people psychological support and try to reduce at a societal level the social reactions. So those are some of the ethical considerations that should be there. So as we summarize this aspect of psychological and social implications, you have to look at infertility care and the societal change. So addressing societal beliefs about childless couples. That is one. Two is raising awareness through media, patient organizations, and policymakers. So our biggest challenge always is that the society has a wrong thinking, or they stigmatize the entire process of infertility. That if someone is infertile, their position in the society is already determined, and it is very low. That this man does not bear children, he has been given money, or he has a lot of money, but he does not have children. So we need to address some of these societal beliefs. And how can we address them? Through raising awareness, through media, patient organizations. We need to do healthcare education. We need to continue to counsel society about these challenges of infertility. So the diagnostic simplifications. Simplifying diagnostic procedures for accessibility. However, in African countries, what is more easier to access is actually these diagnostic simplifications. But what is hard to access is the therapeutics. So we need to simplify the diagnosing, the diagnosing people. That procedure for diagnosing, it needs to be accessible. The same way, for example, when people are celebrating the World Breastfeeding Day, World Breast Cancer Day, the same way, the information on testing or checking yourself for breast cancer is being preached should be the same way testing for infertility is. It is very easy that you need to just step into a health facility, and the process of diagnosing you should be very easy. For example, you need to step into the facility, and then you should be able to tell openly to your doctor that my problem is this. Probably that I rarely erect, or then immediately the process of diagnosing needs to be simplified at that particular stage. So how can this be done? There can be a one-day clinic or a streamlined workup process. In very many hospitals, we have seen this happen, where there is a day or there is an hour that is scheduled for these infertility diagnostics. So for someone to be able to go for the diagnosis, they will know that it is on this date, and then they can be able to go and get that diagnosis in there. Then we look at low-cost art approaches. It needs to be simplified. Simplification of art methods for affordability. So focusing on lowering treatment costs and while maintaining effectiveness and safety. So you realize that whereas our societies are facing challenges of poverty and so forth, sometimes the treatment, the therapy that is offered to people who are infertile are very expensive, and therefore it may not be easy for someone who is of a lower income level to access such kind of care. So in all these approaches, it is important that our government comes in to help communities so that they are able to come up and access some of these care at a very subsidized price. But we know that these are technologies that are very rare in Africa, so it may not be easy for us to also blame governments, but as their mandate, they need to offer this kind of assisted reproductive technology. Because then if this simplification of assisted reproductive technology is affordable, the cases that the diagnostics but also therapeutics is made easy is there. So there is what we call the alternative ovarian stimulation. You need to avoid high doses of expensive medication, and then use of clomiphene citrate for optimal results. So what happens is that we know that certain medication have certain type of side effects. Most times, when they are discussing side effects, people don't actually, when they get their dosage of tablets, people don't actually focus on trying to read some of the side effects that are there. But I'm always critical when I'm reading the side effects, because we unknowingly take some of these high dosage of medication, and at the end they are actually the problem. There are some of the problems that we are facing regarding infertility. If you just look at our ancestral lineage, the issues of infertility were very rare. So it was not easy that people become infertile, but sometimes because people take a lot of medication, as a result, now that I'm infertile, you decide to take a lot of treatment. At the end, these are the challenges you face. You kill the fact that your ovum needs to be stimulated to get out, because there are hormonal imbalances that it causes. So the ovarian stimulation as a therapeutics can be treated using what we call this clomiphene citrate. It is used for treating infertility in women. And how it works is that the female, ovulation normally occurs as a monthly product where a mature egg is released. However, due to some of the causes of infertility, there are chances that this egg or the egg is not stimulated, and most times it may not be released into the what? Into the uterus. So the role of this particular treatment, this clomiphene citrate, is actually to stimulate uh, or to induce the ovulation. So any number of conditions can hamper the ability to ovulate effectively. One of the primary ways to address this challenge is with medication that can stimulate the ovarian follicle to produce multiple eggs in one cycle. So the most important or the common fertility medication used to promote ovulation is this one, clomiphene citrate, or what people or what some people may refer to as serophene. So if you offer some people serophene, they may be able to regain, because then it stimulates ovulation and releasing of multiple eggs. However, clomiphene is a synthetic chemical that is taken orally. So how it works is that it binds or it goes to the estrogen receptor, because estrogen is actually the hormone that helps in ovulation. So what happens is that it binds to estrogen receptors in the brain and causes the pituitary gland or levels to rise. So when the pituitary levels rise, then the impact is that it directly stimulates the ovaries. Then cost reduction in laboratory procedures is another way for accessing cost effective. You need to lower laboratory procedures. Yes, whereas we know that they are very expensive, but in order to promote care, it is important that the laboratory costs or the procedures are lowered. So this can be done by use of humid crib. Humid crib, humid crib is also known as an incubator or an isolate. It is just like a clear plastic box that provides a warm, controlled, clean, enclosed environment where the baby can easily be observed. So it is mostly used for cases such as preterm, for babies that, okay, for babies that may be may be born in an incubation somewhere there. So it is used to monitor such babies, and most times the incubator helps in increasing the a live birth, possibility of a live birth. So these are some of the alternatives that should be used in trying to navigate infertility there. Low-cost IV methods using intravaginal fertilization and culturing. Then achieving reasonable clinical pregnancy rates. That will be automatic. If you use these low-cost IVF for babies, then it helps, because that it is this IVF is associated with high levels of estrogen. The same way they help, the same way we talked about the therapeutics stimulating the ovaries. This is also just the same way. However, for this one, this is an insertion. However, it has several side effects that you will always have to look at. This IVF has a lot of the side effects that most people, if you look at the history of using this IVF, most people have problems with it. In other words, let me just write for you here. IVF some people call it intravaginal fertilization, others call it in vitro. So when I'm referring to IVF, I'm referring to intravaginal fertilization. It is a well-known and widely used assisted reproductive technology, and across the globe, it has helped actually very many people or millions of people to to achieve their dreams of having a child. But however, like any other uh, procedure we talked about, this particular intravaginal fertilization, it has some of the benefits, but also it has some of its what side effects, like I said. So you most times, because you're very desperate in that regard, you may not have to look at necessarily its negative perspective. So the challenges are here. Challenges in low cost IVF, intravaginal fertilization. The challenges are there is need for studies on simplified diagnostic and art techniques, maintaining quality while reducing costs. So the low cost IVFs have quite a lot of problems, and it has been associated with challenges that it produces a very high stimulation, because it produces high estrogen levels, and this can cause a risk of premature and low birth weight. So the biggest challenge with the use of these low cost intravaginal fertilization art techniques is that because of the method through which they perform, which is mostly increasing someone's estrogen levels, and most of the time, the infertility that occurs in many of the African population is because of the body's inability to stimulate the ovaries. This is amongst women, but also the inability of the body to produce estrogen, that is the body stimulator for fertilization processes. So the way these art or these particular technologies work is in a way that they induce the body to produce these high estrogen levels. So the challenge is that when these levels are high, there are chances that the babies are born low weight, but also there are challenges that they are premature birth. And we have seen this is most common among mothers who normally use this particular art, this therapy or this technology when they are infertile, and if they use this kind of technology, we have realized that they face many of these challenges. So some of the risks and considerations, we need to address the complications and the quality of care. We know that there are complications in doing this. There's technology, you need to do this, you need to do that. There are quite a lot of complications in there, and they are quite a risk. For example, taking these intravaginal fertilization therapeutics, there are chances that when you take them, the chances of premature birth and so forth, these are some of the complications and risks that are taken and which need to be addressed so that this is more quality and more effective. So the consideration is that there needs to be some reproductive tourism and some global inequality concerns. So people need to look at how they can go and understand how some countries do it, and network and build their capacity in those communities, so that at the end they can be able to develop strategies and handle issues of inequality. And inequality in this regard, we look at even the income inequalities that occur, because sometimes individuals may be having low income challenges, but because the society is a little with a lot of inequalities, these people are also isolated in the healthcare system. Therefore, we need to look at issues regarding inequality so that people are able to access these services frequently, but also at a very low cost and without discrimination in there. So to overcome some of these barriers, we want to look at addressing the cultural, addressing the religious, and religious and the social barriers. Then we need to also educate traditional healers and integrating modern practices. We understand that our society is predominantly religious, our society is bound by cultural norms, our society is bound by cultural values, but also there are social barriers around. So because your peers, you live more with your peers, there are chances that you will be able to stay around with your peers most times, and there are chances that they will influence your behavior. So we need to address some of these challenges. Having understood health behaviors, I think we're in a proper position to address some of these problems. And if you are able to educate traditional healers, because actually infertility is one of the public health problems where these traditional healers have thrived, because they will have a lot of concoction and all over the way, because couples or because families have looked for solutions in vain. They have gone to the churches, they don't have the solution. They have gone to the cultural leaders, they don't have the solution. And then at the end, they will go to the traditional healers who will offer for them concoctions that are roughly even do not work. So if you're able to offer support and educate these traditional healers and try and integrate them to modern processes, there are chances that we can be able to solve and overcome these barriers. So that is that far for that particular for this particular lecture on psychosocial and social implications of infertility. Unless we have any questions on that regard, I would want to end there for today. Yeah.